February is American Heart Month. Time to pause, reflect, and focus on one of the most important organs in your body, your heart. Heart disease affects millions of people every year, but the good news is that with the right care, support, and lifestyle choices, many people are able to live full and active lives. Understanding your treatment options is a powerful first step. Whether you've recently been diagnosed or you're supporting someone you love, knowing how heart disease is managed can help you feel more confident, informed, and in control. In this article, we'll walk through the most common heart disease treatment options, from medications and lifestyle changes to procedures, rehabilitation, and long-term care, so you know what to expect and how each option supports your heart health. Understanding heart disease treatment options. Heart disease treatment isn't one size fits all. Your care plan depends on the type of heart condition you have, how severe it is, and your overall health. For many people, treatment involves a combination of lifestyle changes, medications, and ongoing monitoring by a healthcare team. In some cases, procedures or surgery may be necessary to prevent serious complications such as heart attacks or heart failure. The goal of treatment is not only to manage symptoms, but also to protect your heart, improve blood flow, and support your quality of life. Medications that help manage heart disease. A healthcare team, often led by a cardiologist, may prescribe one or more medications to help manage heart disease. Each medication works in a different way, and many people take a combination to get the best results. ACE inhibitors. Remember that name, you may hear it often. These medications help lower high blood pressure by relaxing blood vessels, making it easier for the heart to pump blood. Common examples include lisinopril, benazepril, and ramipril. Angiotensin receptor blockers, or ARBs, work in a similar way. They help open up blood vessels and reduce blood pressure, especially for people who can't tolerate ACE inhibitors. Medications like losartan, valsartan, and olmesartan fall into this group. For people with heart failure, doctors may prescribe ARNIs, or angiotensin receptor neprilysin inhibitors. These medications improve blood flow by relaxing blood vessels and reducing strain on the heart. One well-known example is Entresto. To reduce the risk of blood clots, which can lead to heart attacks or strokes, antiplatelet therapies like aspirin or clopidogrel may be recommended. These medications help keep blood flowing smoothly through your arteries. Beta blockers are another cornerstone of heart disease treatment. They slow the heart rate and reduce how hard the heart has to work. Medications such as metoprolol and carvedilol are commonly used and often prescribed early in treatment. Calcium channel blockers help relax blood vessels by limiting calcium's effect on the heart and arteries. This lowers blood pressure and reduces chest pain. Examples include amlodipine, deltesum, and verapamil. Some newer medications also play an important role. GLP-1 receptor agonists, like semaglutide, help manage blood sugar and weight. Both major risk factors for heart disease, may lower the risk of heart attacks and strokes in certain higher-risk individuals. For people with chest pain or coronary artery disease, nitrates can be helpful. Long-acting nitrates support ongoing blood flow, while short-acting nitroglycerin works quickly to relieve sudden chest pain. Other medications, such as SGLT2 inhibitors, help people with type 2 diabetes manage blood sugar, blood pressure, and weight factors that strongly impact heart health. And finally, statins are widely used to lower cholesterol levels. By reducing plaque buildup in the arteries, statins help lower the risk of heart attacks and strokes over time. How to lower your risk of cardiovascular disease. While heart attacks can happen at any age, there are meaningful steps you can take to protect your heart starting today. Keeping track of your blood pressure, cholesterol, and triglyceride levels is one of the most important things you can do. These numbers offer early clues about your heart health, even before symptoms appear. Managing long-term conditions like diabetes is equally important, as high blood sugar can quietly damage blood vessels over time. Maintaining a healthy body weight doesn't mean striving for perfection. It means finding balance. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins helps fuel your body and protect your heart. Limiting saturated fats, excess salt, and added sugars can reduce strain on your cardiovascular system. Physical activity plays a powerful role too. Even moderate movement like walking, cycling, or stretching can strengthen your heart, improve circulation, and lower stress. The key is consistency, not intensity. Lifestyle habits matter more than many people realize. Limiting alcohol, avoiding smoking, or quitting if you currently smoke can significantly reduce your risk. Smoking, in particular, damages blood vessels and raises blood pressure, making heart attacks more likely even in younger adults. Stress management is another critical piece of heart health. Chronic stress can increase inflammation and blood pressure. Practices like mindfulness, meditation, journaling, prayer, or simply taking time to rest can help your heart recover from daily pressures. And don't underestimate the power of sleep. Getting enough quality sleep allows your body and your heart to repair and reset. Poor sleep over time is linked to higher risks of heart disease. Listening to your body matters. One of the strongest messages from the stories you've heard is this: you know your body best. Heart attack symptoms don't always look the same, especially in younger people and women. Chest pain may not always be the first or most noticeable sign. Shortness of breath, nausea, jaw or back pain, dizziness, or extreme fatigue can all be warning signals. If something feels off, if symptoms are sudden, severe, or don't go away, seek medical care right away. Acting quickly can save your life. A final word: heart attacks aren't just an older person's problem. They can happen in your 20s, 30s, or beyond, sometimes without obvious warning signs. But awareness, early action, and healthy choices can make a real difference. Whether you're taking steps to prevent heart disease or managing a diagnosis, know this: a heart condition does not define you, and it does not mean your life is over. With the right care, support, and commitment to your health, many people go on to live full, meaningful lives. Your heart works for you every single day. Taking care of it any age is one of the most powerful investments you can make. Understanding racial disparities in heart health: heart disease is the leading cause of death for adults in the United States, but its impact is not felt equally. Black Americans are far more likely to live with heart and cardiovascular diseases than any other demographic in the country. The term heart disease includes a range of conditions, such as coronary artery disease, heart failure, stroke, and peripheral artery disease. Across nearly all of these conditions, Black adults face higher rates of diagnosis, complications, and death. This increased risk isn't just about biology. While genetics can play a role, it's only one part of a much larger picture. Why is heart disease more common in the Black community? Black Americans are disproportionately affected by chronic conditions like high blood pressure, diabetes, and obesity, of which significantly raises the risk of heart disease. These conditions often develop earlier in life and are more difficult to manage long-term due to barriers that go far beyond individual choice. Where people live, work, learn, and access care matters. These factors are known as social determinants of health, or SDOH. They have a powerful impact on heart health. The role of social determinants of health. Social determinants of health include things like access to quality health care, safe housing, clean air, nutritious food, reliable transportation, and economic stability. For many people of color, especially Black Americans, these resources are harder to access. Structural racism, environmental pollution, under-resourced neighborhoods, and healthcare inequities place chronic stress on the body over time. That stress doesn't just affect mental health, it directly impacts blood pressure, inflammation, and cardiovascular function. Living in areas with higher pollution levels, limited green spaces, and fewer grocery stores with fresh food options can increase the risk of developing heart disease. Limited access to preventive health care can mean conditions like high blood pressure go undiagnosed or untreated for years. Over time, this constant strain increases the likelihood of cardiovascular disease and worsens outcomes once a diagnosis is made. Heart disease, deaths by race and ethnicity when looking at the percentage of deaths in the U.S. caused by heart disease. Clear disparities emerge. Among non-Hispanic Black Americans, heart disease accounts for approximately 22.6% of all deaths, the highest of any racial or ethnic group. This is followed by Asian Americans at 18.6%, Native Hawaiian or other Pacific Islander populations at 18.3%, and non-Hispanic white Americans at 18.0%. American Indian and Alaska Native populations experience heart disease-related deaths at 15.5%, while Hispanic Americans have the lowest percentage at 11.9%. These numbers highlight an important truth. Heart disease is widespread, but its burden is unevenly distributed. Peripheral artery disease. An overlooked example, peripheral artery disease, or PAD, is a common but often underdiagnosed cardiovascular condition. It affects more than 12 million Americans and occurs when narrowed arteries reduce blood flow to the limbs, most often the legs. Black Americans are twice as likely to develop PAD compared to their white peers. This higher risk is closely tied to social determinants of health that increase exposure to smoking, diabetes, and high blood pressure. Despite its prevalence and serious complications including pain, mobility loss, and increased risk of heart attack or stroke, most people in the U.S., including many in the Black community, have never heard of PAD. Lack of awareness leads to delayed diagnosis, fewer treatment options, and worse outcomes. Looking ahead, understanding racial disparities in heart health means looking beyond individual behaviors and acknowledging the broader systems that shape health outcomes. Education, early screening, culturally competent healthcare, and policies that address environmental and economic inequities all play a role in improving cardiovascular health. In the sections ahead, we'll explore how lifestyle, environment, access to care, and community-level solutions can help reduce heart disease risk and what steps individuals and healthcare systems can take to close these gaps. Heart health isn't just a personal issue. It's a community issue. Any issue, and addressing disparities is essential to saving lives. What is normal heart rate variability, HRV? Heart rate variability, often called HRVs, a powerful but often misunderstood measure of heart health. Rather than counting how fast your heart beats, HRV looks at the small changes in time between each heartbeat. Those tiny variations may seem insignificant, but they actually reveal how well your heart and nervous system are working together. In general, a higher HRV is linked to better cardiovascular fitness, stress resilience, and overall health. Understanding heart rate variability. Your heart doesn't beat like a metronome, and that's a good thing. Heart rate is simply the number of beats per minute. Heart rate variability, on the other hand, measures how much time passes between those beats. Even if your heart rate stays at 60 beats per minute, the space between each beat naturally shifts by a few milliseconds. These variations are normal and necessary. They allow your heart to quickly adapt to changes throughout the day, whether you're sleeping, exercising, feeling stressed, or relaxing. For example, your heart rate might be slow and steady while resting, then speed up when you climb stairs or rush to work. HRV captures how flexible and responsive your heart is during those changes. What influences HRV? Many everyday factors can raise or lower your HRV, including alcohol use, chronic stress, anxiety, or depression, body weight and body mass index, caffeine intake, genetics, inflammation or infection, age and biological sex, your circadian rhythm, or internal body clock, smoking. Because so many factors affect HRV, it's best viewed as a personal trend over time, not a single number to compare with others. What is considered a normal HRV? For most healthy adults, average HRV typically falls between 19 and 75 milliseconds. However, what's normal can vary widely from person to person. A lower HRV may be associated with heart conditions like heart failure or irregular heart rhythms. It can also reflect chronic stress, poor sleep, inflammation, or aging. A higher HRV is often seen in people with good cardiovascular fitness. Athletes in particular tend to have higher HRV because regular training improves how efficiently the heart pumps blood. That said, higher isn't always better. Certain heart rhythm disorders, known as arrhythmias, can also cause unusually high HRV. Context always matters. How aging and health conditions affect HRV as we age. HRV naturally tends to decline. Certain health conditions can lower it even further, including inflammatory diseases, chronic pain, mood disorders, sleep disorders. This is why HRV can be a helpful early signal, sometimes reflecting changes in health before noticeable symptoms appear. How your nervous system controls HRV. HRV is closely connected to your autonomic nervous system, the system that controls involuntary functions like heart rate and breathing. It has two main branches. The parasympathetic nervous system, it's often called rest and digest, which slows the heart rate and supports recovery. The sympathetic nervous system, known as fight or flight, which increases heart rate during stress or danger. A healthy heart can shift smoothly between these two systems. Higher HRV usually means better balance and flexibility between stress and recovery. Why tracking HRV can be helpful. Monitoring your HRV can offer valuable insights into your health and lifestyle. It can help you evaluate habits like sleep, exercise, and stress management. If your HRV drops, it may be a sign your body needs rest or recovery. Athletes often use HRV to guide training. A higher HRV can signal readiness for intense workouts, while a lower HRV may indicate it's time for a lighter session or rest day, helping reduce injury risk. HRV can also provide clues about stress levels. A consistently low HRV may suggest your body is stuck in fight or flight mode and could benefit from stress reduction. How to measure heart rate variability. HRV is measured by tracking your heart's electrical activity. Medical devices like electrocardiograms, also called EKGs, offer the most precise measurements. Pacemakers, implantable defibrillators, and medical heart monitors can also track HRV. Many people now measure HRV at home using wearable devices like smartwatches or fitness trackers. While these devices don't replace medical testing, they can be useful for tracking trends over time. Ways to improve your HRV. Regular exercise can improve HRV by strengthening the heart and supporting the parasympathetic nervous system. Treating underlying health conditions may also help raise HRV. Other strategies that may support healthier HRV include slow, controlled breathing exercises, meditation and mindfulness, reducing chronic stress, eating a Mediterranean-style diet rich in whole foods and healthy fats. Small, consistent lifestyle changes can make a meaningful difference. When to contact a healthcare provider? Reach out to a healthcare provider if you notice unusual heart rate patterns, such as a heart rate that doesn't rise with activity, or one that feels rapid or irregular at rest. Certain arrhythmias, including atrial fibrillation, can significantly affect HRV. If you're concerned about your readings or your heart health in general, medical evaluation can help determine whether further testing is needed. When to contact a healthcare provider, reach out to a healthcare provider if you notice unusual heart rate patterns, such as a heart rate that doesn't rise with activity, or one that feels rapid or irregular at rest. Certain arrhythmias, including atrial fibrillation, can significantly affect HRV. If you're concerned about your readings or your heart health in general, a medical evaluation can help determine whether further testing is needed. Heart rate variability isn't about chasing a perfect number. It's about understanding how well your heart adapts to daily life. Tracking HRV over time can help you better understand your stress, recovery, and overall cardiovascular health, and guide smarter choices for your body and mind. Heart rate variability isn't about perfection. It's about awareness. By paying attention to HRV, you're learning how your body responds to stress, rest, movement, and recovery. Over time, those patterns can offer valuable insight into your heart health and overall well-being. Whether you're an athlete, fine-tuning performance, someone working on managing stress, or simply curious about your health, HRV can be a helpful tool. Small choices like moving your body, getting better sleep, and taking moments to slow down can support a healthier, more resilient heart. And remember, numbers are only part of the story. If something feels off, trust your instincts and talk with a healthcare provider. Your heart works hard for you every day. Listening to it is one of the best ways to take care of it.